This is Dr. Russell Libby from Virginia Pediatric Group, and I want to talk to you a little bit about COVID testing. Certainly, as we know, kids can get sick, and some kids may not even get sick when they have the COVID virus. There are times when we might think it's really important to get testing done. When we have a child who has a very clear known exposure, that might be a time within 2 to 14 days after that exposure to get tested. We also have situations where kids actually are sick and demonstrate the symptoms that really do suggest they might have COVID. A cough, fever, some various and fairly nonspecific symptoms, diarrhea. If they're a little older, they might complain of sore throat. Even runny nose, things that we just don't always have that specific an understanding of, but may suspect because of history that they could have COVID. And those tests are generally those PCR tests you hear about. These have been around for at least 6 or 8 weeks, and we are using them to identify those who have actual active infection and are shedding virus. It's really important to know, because then we have to keep those people separate from everyone else in a very concerted effort to keep them isolated. The other tests you hear about are called antibody tests. And those generally are not necessarily as reliable nor as informative as that PCR test. But we make antibodies when we get infected. These are the agents that help fight off infection. We have an early phase and we have a later phase. That early phase may come in the first week or 2 of infection. That later phase may come in the second week to 3 or 4 weeks later. And in some people, it really never even shows up, or at least not so that we can test it and identify it. When we get these tests, we are looking for immunity, which means that you have had evidence of infection, and that infection, at this point, you've survived pretty well. What we can do with those tests is help inform, and they help keep us a little bit more aware of where we've been, what we've been doing, and who might be at risk. But they don't necessarily give us that information that says, hey, you've got a permit, you can go anywhere and not worry. We're still worried that people can get infection even when they have evidence of those antibody tests being positive. So we do have them starting probably next week, in the second week, third week of May. The blood tests that are quick, rapid tests, we can get the nasopharyngeal swabs as well. We can do them in the office. We can even arrange to do them in your car if you're afraid to come into the office. So call us, talk to us. We have the telemedicine visits. We have the office with information on our website, as well as through our triage. So call, make sure you let us know that's what your concern is, and we can talk about what testing is and what it can do for you.
Check out our website at vapg.com, where you will find out all kinds of information about your children through educational resources, videos, as well as learn about our offices and how to connect with us.